And you found us. Welcome back. It's Chambers, Changes, and Conversations, the podcast where we explore the stories, people, and innovation shaping Manatee County. I'm Communications Division Manager Casey Zempel, along with Stephanie Garrison. She's our Director of Government Relations. And today we are joined by somebody with over 17 years of experience in emergency medical services, currently overseeing 6 divisions of public safety from EMS to emergency communications to beach patrol and pool safety. He's led groundbreaking programs like the Mobile Integrated Health Initiative, introduced cutting-edge drone delivery systems, and continues to push forward the county's mission of getting the right care at the right time in the right place. Welcome to Chambers, Changes, and Conversations, Deputy Director of Public Safety, Mr. James Crutchfield. Welcome, sir.
Oh, thank you.
So glad to have you here.
And, let's start by satisfying a request from a citizen, a longtime listener and longtime former employee. Larry Lou, this one's for you. Manatee County has an incredibly rich EMS history, going back over 50 years to when we became the first county in Florida to create a department solely dedicated to emergency medical care. Can you walk us through that evolution from those early ambulance days to the professional EMS service that we know today?
Sure. So I would just say, I haven't been here the entire 50 years or more of Manatee County EMS. I've actually been in the county for 14 years, and all 14 years has been in the Department of Public Safety. I did have the opportunity to celebrate the county's 50th year with Assistant Chief Larry Lou at the time. Manatee County EMS has been on the cutting edge of service delivery from its inception. From being the first county-ran ALS department in the state to receiving awards every 10 years or so, to being the longest-running mobile integrated health program, community paramedic program in the state. The county's done a pretty exceptional job at, being the first and being the best. 1972 is when the county established its EMS program. It was previously ran by funeral homes, just like other ambulance providers across the United States.
Yeah, Gene Brown actually mentioned that on a previous episode.
So then what happened? How did we get to where we are today? Tell us a little bit about our fleet, because, years ago you went from 5 vehicles, 19 staff, and now we're this full-scale, award-winning department doing all kinds of futuristic things.
Sure. I mean, it was pretty generic at the beginning. You would think of it like Johnny and Roy, a small ambulance company, going to a few calls to now the county's running close to 60,000 calls a year.
Wow.
With over 200 dedicated EMTs and paramedics providing that service 24 hours a day, 7 days a week.
Wow.
At the beginning, the service was just an advanced life support, which means you have to have a paramedic on an ambulance responding to the call. Now, Manatee County has kind of evolved, if you will, to have BLS ambulances where they are EMTs only, or ALS ambulances, which are advanced life support, which also has a paramedic, coupled with some telehealth options and some community paramedic options too.
So, give us an idea of the volume your team is doing today. In terms of, you mentioned that many calls. What's a typical day for your team?
Yeah, so for the public safety team, it varies department to department. But for the emergency medical services division, they're running close to 200 calls a day. And typically, the workload of each individual ambulance, it varies based off the location inside the county. The closer you get to the urban core, the higher the call volume. And typically, the call types vary based off the geographic region of the county as well.
Sure. And what's our response time right now?
So on average, it's about 8 minutes.
That's great. And I know one of the things that you were sharing with me is our incredible 911 team as well.
Yeah. I have a special place for all public safety employees. I joke with my peers across the county, we are the best department. We are very mission-driven and really team-oriented. But for the telecommunicators, the dispatchers who are taking the 911 call, they are the first person to handle someone's crisis. So, they're able to control, command a call like you and I probably wish we could.
Yeah. So give us just an idea, what kinds of calls are coming in? What are some of the main themes of calls that we get in Manatee County?
Well, I will tell you that the number one transported related injury here in Manatee County is a fall.
A fall.
Yeah. So, but people call 911 for anything and everything that you can imagine. From, I need a prescription refill, my doctor told me to call, I stubbed my toe, to, those critical life issues, like my loved one has stopped breathing or someone has overdosed.
So you guys have a visual representation of some of the successes of your 911 telecommunicators right in the Public Safety Center, and it's a giant tree when you walk into that lobby. Can you tell us a little bit about that?
Yeah, so we call that the tree of life.
Yeah.
So every opportunity that the telecommunicator has to deliver a baby over the phone or to start CPR, they indicate different things on the tree, from leaves to flowers and things like that.
And that tree is full.
It is pretty full. We have a very busy 911 system here in Manatee County, and we have some amazing employees that are here to make sure it works every day.
We sure do. And so tell us, what's some of the secrets? Because I see our team as incredibly innovative, and we're doing some really futuristic things.
Yeah, for me, I think the county has taken pretty good care of me, and I think the county takes good care of every employee. And I think because public safety employees have a certain personality, we always try to find solutions to a problem, right? When you call 911, an ambulance arrives, and sometimes there's not a script for every problem that people have. So by the nature of the job that we're tasked with doing, we're problem solvers. So with that being said, I think that it sparks innovation in the Department of Public Safety.
Yeah.
Like, we identify something and we're like, there's better ways to do this.
Yeah. And what's one of those ways?
So the Mobile Integrated Health Program is one of those ways. Yeah. So way back when I had first joined the county, I started on an ambulance like most employees. I had come from an ambulance provider in North Carolina, transferred to the beautiful sunny state of Florida, and we were having some pretty significant operational issues with offloading people at hospitals. I had talked to the county's medical officer, Dr. Binsey, who was still the medical officer at the time, and it was like, well, we've got to be doing something better. So through some conversations, we ended up applying for a partnership grant through the Agency for Healthcare Administration, and we started a community paramedic program to help people from not calling 911.
Right.
Like, it seems crazy, but the whole purpose was to put the 911 system out of business. So preemptively going out, educating people on when the right time is to call 911, helping them understand that, going to the ER probably isn't always the best solution, connecting them to a primary care home, and addressing some of their social needs that drive legitimate medical issues.
So what were some of those education gaps you were filling? Like, what did people not know that you found yourself, really helping people know there's another alternative?
Well, it's fairly simple. People go and ask for help and guidance when they go to the doctor's office, right? And when they feel as if they don't know what else to do, they call 911. When they go to the hospital, they get treated by a provider, a doctor, and then they get discharged with a packet of information. And often, we live in a community that is a melting pot, and some people, English is not their first language, and sometimes they're unable to read and comprehend at a level that makes sense for them to make actionable change. So the easiest example that I can provide you would be someone with diabetes, right? It's important that you eat timely every single day. And when you don't eat at the same time every day, or you don't eat a balanced meal, sometimes bad things can happen. Your sugar can go too high. It can go too low. And sometimes when that happens, it does result in an ER visit.
So what were some of the ways that have really we've seen change with the Mobile Integrated Health Unit?
Yeah, so it started with 3 employees, and we have, right now there's 10. So there's 10 dedicated people over there working with individuals that are often forgotten in the medical space, predominantly uninsured or underinsured with, maybe like a Medicaid payer, or sometimes Medicare is paying, but they don't have the right additional insurance coverage to get a certain medication, or maybe they don't understand that the food that they're eating in their pantries, interacts with the medicines they are taking. But overall, the biggest change that I would have to say is like some of the community buy-in has been pretty impressive.
Yeah.
Yeah. So, the city of Bradenton is a perfect example. They saw what we were doing with our outreach team, helping people who are homeless in the community. And they were like, why should we reinvent the wheel? Why don't we pay for an FTE and you guys continue doing the work that you're doing? And plus, there's economy to scale. You have a whole team to support this one person.
Yeah.
Right. So we're getting the buy-in from the city as well. Can you think of any example or story from someone in the community that just has stuck with you as like how this program is really a game changer?
Oh, and there's so many stories. And I think like the power behind some of these type of social programs is, numbers are numbers, but when you hear someone's testimony, it is very moving. From patients who are here, or clients that are here in the community who have no family and really find a connection with our team members, to helping people get a house that they haven't had for like the last 5 years, to some basic human necessities that usually hit me the most is like when someone shares with you that they haven't had a shower in a couple days, or they haven't eaten over a week and they've just been eating some fast food or something from the convenience store. It's pretty impactful. And I think that one of the things that we've kind of implemented over in public safety is, we all go through burnout. The job is really tasking. Sometimes we see the worst in people. I think like the community health team has the ability for you to remember your why. Because you see people and you're helping people and they're just so grateful. And you don't often get that when you're doing other public service type jobs.
Right. Certainly not behind a desk. Yeah.
Not behind a desk, not with some of the other divisions inside public safety. So it is impactful, and there's like thousands of stories that we could share. We had an employee, her name is Angie. She case managed a homeless individual. So through her case management, she got her housed. She ended up going into an assisted living facility, which requires a long list of authorizations. A certain level of provider has to sign off on it. So you have to have a medical license, or you have to have like a provider identifier. So a licensed clinical social worker can sign on those things. Anyways, long story short, her client ended up dying, and she had no family. But through the relationship that she established with her, she shared with her some pretty intimate and personal things. And one of her wishes was for her to be buried at sea. So because she was an uninsured indigent, the county has a program. We have an indigent burial program in Palmetto. I'm not sure if you guys are aware of that. Yeah. So through that, she was cremated, and there was no one to claim her remains. Angie went and claimed her remains, and then she chartered a boat and buried her at sea.
Wow.
That is a county employee,
right?
Like legitimately doing things that matter. Like
she
that
felt
matters.
called to
Yeah.
do.
Yeah.
One thing I've learned about public safety is you guys are incredibly modest about what you do. And just last week, the commissioners approved your continued participation in the mobile integrated health program. But you guys are really, you're leading this on a statewide level, and the state is looking at you for transmittal of data to see what you're doing right and kind of digging into the metrics. What does that say to you about, people like Angie and people like the rest of your team when the state's looking to us for guidance and continued participation in this program?
Well, in the simplest terms, I think that we are the best. I think that I was excited to share our information, because at the end of the day, the need is outside of Manatee County, and it is so easy to take care and do what we do. Sometimes you just need to pause and reflect, like, why are we doing it this way? Our data set, when it goes to the state, it makes our local data actionable at the state level. I did have the opportunity to sit on the advisory board for the state's access to care and kind of drove some Manatee County best practices at the state level. I had the opportunity to help write the guidebook for community paramedics.
Tell us about some of those. What
Yeah.
were some of those best practices that you were outlining?
Yeah, so I think that, the challenge is a lot of times public safety and EMS is ingrained in tradition, which can be challenging to step outside the mold. And Manatee County is guilty of that sometimes too. When we first started the community paramedic program, and we've been changing the name back and forth multiple times in this conversation, but it is the community health program. We only had paramedics on the team, and it was just so crazy. Why would we be tasking a paramedic who has the ability to do a lot of things? I'm a paramedic by trade. So I'm not downplaying, the role that they provide in the healthcare field, but there are people that are specifically trained to address social needs and to address behavioral needs and behavioral change. And those are social workers.
Yeah.
Like, why would we not just hire a social worker to address these things that are driving the demand of the 911 system to a point of inefficiency? All right, so if someone is calling 911 because they can't get a hold of their doctor, that's a behavioral issue. If someone is calling 911 because they don't have access to nutrition, that is a behavioral issue. It can become a medical emergency, but all of those things can be addressed with a social worker. So, coming back to your question is, what are the changes, I feel like I have helped advocate for at the state level, is that EMS doesn't need to be EMTs and paramedics.
Right.
And in fact, here in Manatee County, we have EMTs, paramedics, nurses, a nurse practitioner, social workers, case managers, who all make the 911 system operate as efficiently as it does here in Manatee County.
Wow, that's a really interesting thing. And so is that uncommon across Florida?
Well, across Florida, yes. The Florida pre-hospital market is predominantly operated by fire agencies. And fire agencies do one thing fairly well, and they are very strong in tradition.
Sure.
I think that when you get outside of the state of Florida, you see more third service providers, which is what our local government is. We're considered a third service provider, operates separate from a fire district or a fire agency. And a lot of those are now starting to hire social workers. There's some larger agencies that have multiple physician's assistants or nurse practitioners.
So it sounds a lot like it's not just about, medical response. It's about community connection and connecting with the community in a completely different way.
Yeah, a community health.
The community health.
Because health
right?
is so much more than just an emergency, right?
Exactly. That partnership goes even deeper with technology. And at the Emergency Communication Center, front door to every response has a very important tool in their toolkit. And you've spoken about it before, MD Ally. How does this technology reshape kind of the way, and some of the things you were touching on before about 911 calls and emergency response?
Yeah, so Manatee County is the primary answering point. So they answer every single 911 call that happens in the geographic region of Manatee County. And from there, these professionals, the telecommunicators, the dispatchers, prioritize the calls, and sends them to the right receiver, if you will. So if it's a law enforcement emergency, often they send them over to MSO. And inside of the dispatch center at the Public Safety Center, MSO sits up there with county employees. And like you said, they are the front door to every single call that occurs. And one of those things that they have in their toolbox is it's a vendor. And the vendor is a telehealth provider. Our vendor here is MD Alley. And what they do is they integrate into the computer system. And once certain criteria is met, they become eligible to get a telehealth visit right when you call 911.
Wow.
It is super cool.
And what kind of services could they get from the telehealth provider?
Almost anything, honestly.
Really? I mean, are they talking to doctors, nurses?
Yeah, I mean, they're talking to physicians, so doctors. Wow. Yeah, so
that's awesome.
Think of it like if you were on your personal phone, and we're very fortunate to have insurance, but often people don't, and they're calling 911 because they don't know what else to do. And I think we've talked about that a little bit. We can pull up on our phone our doctor or do a televisit. It's essentially the same thing. So if you call 911 and let's say I've ran out of my blood pressure medicine, right? So I'm out of my blood pressure medicine. I need to go to the hospital. The telecommunicator is answering all these or asking all of these questions. From there, they'll say, well, you're eligible to speak to a medical provider right now. Are you willing to do so? And then they just transfer the call over to the medical provider. And, we had some naysayers at first about, is there a liability? Is there, risk to the county? I mean, I'm no attorney, but I would say there's not, right? And we do have time for time where the caller will escalate or they'll provide the provider a different question or a different answer to a question, which would indicate that it is an emergency.
Right, and do what's necessary.
And then the call comes back and then the ambulance goes.
I love that, that we're actually treating the need with the best resource available, which might be the telehealth provider.
Yeah, it's like the law of diminishing return, right? So, for the longest time, Manatee County has done a fairly decent job with adding ambulances as people come into the community, right? But as we all know, I mean, the community has really taken off lately, right? We've gotten new schools, we've got new business, new roads, new houses, and all of that is challenging when you're trying to operate an ambulance service. Ambulances take 3 years to build, and stations there's the whole RFP process,
right.
And then you need to onboard and train employees. So, looking at things from a multi-pronged approach is super critical when it comes to critical situations, right? So, if we can take the calls that don't require an ambulance out of the mix, it allows, the ambulance system to operate so efficiently.
And what's been the response from people who have actually used this service? The public, I mean.
Oh, yeah. I mean, so we do feedback surveys. They do monthly surveys, not just for the telehealth component, but for the 911 program itself, from the dispatch all the way through to the carrier getting at your house or through transport to the hospital. And, we get good remarks all the time.
Yeah.
And I think that, when someone's in a crisis state of mind, doing anything is better than doing nothing.
Mm-hmm.
So, keeping that in mind, I think that's what drives, our community buy-in, our community support.
Mm-hmm.
People love first responders. And I think that when someone calls 911, they expect someone to answer, and we always do, right? When someone calls 911 and there is a robbery, they expect law enforcement to show up, and they always do, right? There's a house fire, firemen show up, always happens. And, when someone has a medical emergency, an ambulance always shows up. And I think that because we have that built-in trust, it makes doing the work we do that much easier.
Absolutely. So, with telehealth, the proactive medicine that we're providing, the technology-enabled dispatch, we've seen some incredible leaps forward in community health, but none quite as futuristic as this next initiative. So, Casey, tell us a little bit more about that.
Yeah, so Manatee County became the first in the nation, and I was excited, and I know Stu, the rest of our team is very excited about this one because we're all Part 107 certified. Manatee County became the first in the nation to integrate drone delivery into its 911 system. The future is here, friends.
So cool.
Right? We partnered with Tampa General Hospital and Archer First Response Systems for a groundbreaking pilot program, and that recently just expanded its coverage area. Can you tell us, James, a little bit more about how the program works in real time and what types of life-saving equipment that these drones are delivering as a part of their payloads?
Sure. It is super cool.
It's cool.
All right. And if you go back to what is the job we're trying to do? And the job is that we're trying to keep the community healthy, right? We're trying to help somebody when they're, in this dire need. And based off of the service delivery model that is everywhere, it's not just Manatee County, we cannot physically get to people quick enough when they're experiencing a cardiac arrest or when they're not breathing. You cannot hold your breath for 8 minutes. Right? So that was the problem we were trying to solve. So in a partnership with Archer First Response, which is the drone operator, Tampa General, which has very graciously provided the equipment and some of the upfront costs, if you will, and then our 911 dispatch center. Right? I mean, it is the triad of success, if you will. And much like the telehealth component, this screens calls, and if a caller is in a geographic region, this drone is out at our Malachite EMS station, which is close to Lakewood Ranch ballpark. And if the caller is able to walk outside and is willing to accept an AED or...
What's an AED?
An AED. So that's a defibrillator. When you're walking around Walmart or Publix or some other, public park, there are the boxes that are on the wall. And often, if you were to call 911 because someone has fainted or doesn't have a pulse, the dispatcher will say, "Do you have an AED?" And then the dispatcher will walk you through how to use it. It's fairly simple. You just turn it on, and then you follow audible instructions.
And what does it do? What does it actually do to a human being?
So they're massive stickers that you put on their chest, and it analyzes someone's heart. And if someone is in a lethal rhythm that is deemed shockable, if you will, like you almost see on the TV, where they...
Clear.
Yes,
yeah.
Kind of like that.
Yeah.
It delivers the shock.
Wow.
Why does it matter, right? So it matters because if you were able to deliver that shock within minutes, your chance of survival is exponentially greater.
No, that's huge. So these drones can deliver an AED to someone.
So it delivers 2 things for now, and in the forecast, it's slated to deliver 3. So I'll talk about the 2, and then I'll tell you what's going to come.
Cool.
Yeah, so the AED, which we briefly talked about, again, that is for someone who's experiencing or is in a cardiac arrest. The other item that it brings is Narcan. So Narcan is it's a medicine that you can squirt in someone's nose who is not breathing due to an opioid overdose. Again, it is highly unlikely that you can hold your breath for 8 minutes for a first responder to get there. And there are sections of the county that our response time is much less than 8 minutes, and we operate in a system of care in Manatee County. So we have fire districts that respond, and we have law enforcement that responds. But even at the peak performance, if you will, of the entire system operating the most efficiently, you're not going to beat something that's flying through the air.
No.
Right.
As the crow flies.
You're not going to beat it. There is no way you can do it. So, and then the third item that is soon to be attached into this payload is a tourniquet. And the tourniquet is important because, your body is a vessel, right? And if you're bleeding and you can't control or stop that bleeding, you have to have blood to work. Then that tourniquet can be used for severe bleeding.
Right. So break down, if we're saying our average response time, 8 minutes, what can this drone actually deliver?
Yeah, 2 minutes response.
Wow.
2 minutes.
2 minutes.
After I'm calling, they can say drone is on its way, and in 120 seconds, I've got somebody outside.
It is so cool, and it's, it hasn't been dispatched yet, so it hasn't been used, but that's okay, right? We build systems to ensure the safety and security of our community all the time. But we've ran through multiple simulations in the dispatch center, and I've got to, hear the call come through. I've got to watch it go through a simulation out of it looks futuristic out there. I've seen it take off. It is so cool. And the coolest thing is, the telecommunicator is asking permission to say, if an AED is available, are you willing to use it? And as soon as that answer is yes,
Boom.
he or she is, activating, if you will, this drone that is on the way, and he is still
on the phone
talking. Mm-hmm. Meanwhile, law enforcement or the fire department, EMS, we're all responding along with this additional resource. And it's all trying to improve outcomes.
Yep.
I mean, at the end of the day, the mission of public safety is to keep the public safe.
Yeah.
Right.
So you guys are still responding to these. The drone goes first, and if it gets there, that's great.
Yeah.
But you guys are still responding to the call.
And it's not really like a first, second, third.
Sure.
It's simultaneous.
Mm-hmm.
Right.
So you think of it like when you come into a room and you turn on your lights. The lights don't turn on one at a time. They all turn on.
Yeah.
Right? Mm-hmm. And that's how the dispatch process works as well. So if you meet certain criteria, you turn on that switch and you get the drone, you get the ambulance, you get law enforcement at times, you
That's
get
awesome.
fire agency, and it all happens simultaneously.
When seconds matter, I can imagine this could really make a huge difference to someone, especially if they're not breathing or in a cardiac arrest. How cool is it that our county's piloting these incredible ways that we're rethinking health?
Yeah.
It is so cool, and I think that it's all about having the right personalities in place, right? You have to be okay with knowing that there's no script. No one has done this. So, we're going to try what we think makes sense, and we'll probably need to make adjustments along the way. We know that there'll be some hurdles with community buy-in and making sure that people feel safe and they understand what we're doing, but that's all worth it to us, right? It's worth it to us when, the chance or the likelihood of having such a significant outcome.
Yeah, and I think we're going to start seeing that. I mean, the pilot program was such a small, we were talking a mile, 2 miles out, right? And now it's significantly larger. I want to say 35 miles?
35 square miles.
35 square miles. So that's a huge amount. So like you had said before, we hadn't actually, dispatched the drone or had a success story. We're going to have one very soon, given that large,
Radius.
I just feel it, given that large coverage area.
Yeah, and, I think that we need to provide ourselves some grace, too. Last year was a pretty intense year. And because of the weather that we experienced, all of us have experienced, it created some challenges. The drone was out of service for a long period of time because of the storms. It experienced some water inundation into the housing, which required some electrical parts to be replaced. And then also because it was a pilot project, it wasn't working or it wasn't in service 7 days a week. And it was only flying visual line of sight, which meant that someone physically had to be at the EMS station to watch it launch and to see where it was going.
So cool.
And if you've ever tried to follow a drone in the sky with your eyeballs, looking up in the sky at the sun sometimes, you're talking not very far out.
Yeah.
Yeah.
And that's why it had that very narrow scope, if you will.
Yeah. Oh,
this
cool.
is something I could nerd out about this all day. I'm so sorry. And I know podcasts don't do it justice, but the way that hatch slams open to reveal the drone, it's like whoosh, whoosh,
It's like a bat signal.
and it just takes off. I mean, it's so quick, and you've seen it. I've seen it. I think we've all seen it. It's really something to get excited about if you start thinking about future expansion. It's successful at the Malachite site. Now, what does this do for response on the island where traffic is a concern?
Right.
I mean, it can quickly snowball and turn into something really big.
And agree, this is how your team gets these awards and recognition for doing things, piloting new programs to provide care in ways that we never thought we'd be able to do, in addition to the existing resources.
We're just okay with making mistakes. And I think that's the workplace culture that we have over there. We also were the first on the west coast of Florida to deliver blood pre-hospital. So here in the community, we have paramedics that are infusing blood in the field.
Wow.
Like, that is insane if you think about it, right? And when I first became an EMT, I was an EMT in high school. I was the kid that carried around the pager and, responded to calls in my Volkswagen Beetle, did all the things. And, from going to school to be a paramedic, I started writing patient care reports on paper to, getting computers that I can take with me inside of a person's house or a patient's house, to now we're delivering blood and infusing blood on the way to the hospital. It is crazy.
Wow. Incredible.
And that sound means we have reached our lightning round. Oh my goodness, it's our favorite part of the show. Lightning round, world famous lightning round. Quick questions, even quicker answers. Are you ready, Mr. James Crutchfield?
I sure hope so.
Okay. Coffee, tea, or energy drink before a long shift?
Black coffee.
Okay.
Yeah.
That's good. Most memorable emergency call that you've ever been a part of?
Delivering babies.
One word that describes Manatee County EMS?
World class.
If you could invent any new tool or tech for public safety, what would it be?
Body cameras are everywhere.
Yeah.
Right? I would like EMS to have a body camera, but not for the same use as a law enforcement officer. I would like it to document all the patient care that's being provided.
That's cool. What's a piece of advice that you wish every citizen knew before calling 911?
I think it's okay to call 911. And when you call 911, it doesn't always mean that you need an ambulance.
Favorite piece of gear from back in the day that's now obsolete but you secretly miss?
I really did like my clipboard.
So sweet.
If you could change the siren on an ambulance to a song, what song would it be?
I don't know, because people don't move anyways.
And then last question, and probably the most important, is the mustache back or is it just a phase?
I don't know what happened. I don't know. It just happened.
It looks great. I know. It seems like one day you were clean shaven and the next day I came in, I'm like, whoa.
Yeah, it just happened.
Mustache man.
It's the Burt Reynolds of Manatee County.
Yeah, and I feel like I'm getting encouragement, so I don't know what to do with it. It's kind of getting old for me, but every time I see someone I haven't saw in a while, the administrator, everyone's like, man, you look good in a mustache.
I love it. Deputy Director James Crutchfield, thank you so much for joining us and everything that you and your team does to keep our county safe, not just in emergencies, but every single day. It is a true honor to witness a professional like yourself and work with you.
Yeah, and to learn more about Manatee County's Public Safety Department, go to mymanatee.org and ask Cortez to tell you about public safety, EMS, 911, or emergency management, or any of the other divisions that keep you safe 24 hours a day, 7 days a week. And be sure to subscribe, like, share, and react to this podcast so we can share it out there with as many people as possible. On behalf of the men and women doing work that matters behind the scenes for you, I'm Casey Zempel.
I'm Stephanie Garrison.
And I'm Jimmy Crutchfield.
Make it a great day to live, work, and play
in Manatee County.
The opinions expressed by guests of Chambers Changes and Conversations do not necessarily reflect those of Manatee County government or its employees.